Assalamu alaikum. My name is Mohammad Ahmed Wasim. Roll number is BP1650143. My topic is erythrodermic psoriasis. Now, what is psoriasis? Psoriasis is a genetic disease of dysregulated inflammation. The mechanism of inheritance is not completely defined. Psoriasis is an immune-mediated skin or joint inflammatory disease in which intralesional inflammation primes basal stem keratinocyte to hyperproliferate. The efficacy of immunosuppressive drugs such as methotrexate, cyclosporin, and TNF blocking biologics in treating psoriasis suggest that psoriasis involves immunologic mechanisms. Resolution of process involves immunologic mechanisms. Resolution of psoriasis is associated with decreased lesional infiltration of T cells, dermal dendritic cells, Langerhans cells, and neutrophils, and decreased expression of TNF-alpha, interferon gamma, and interleukin 12/23 dependent genes. Environmental factors also play a role in the pathogenesis of psoriasis, including drugs, skin trauma, infection, and stress. Now, erythrodermic psoriasis. Generalized erythrodermic psoriasis, like generalized pustular psoriasis, is a severe, unstable, highly labile disease that may appear as an initial manifestation of psoriasis but usually occur in patients with severe chronic disease. Precipitating factors include the administration of systemic corticosteroid, the excessive use of topical steroid, the overzealous application of irritating topical therapy, and the consequences of phototherapy and the phototherapy complications, severe emotional stress, and proceeding illness such as infection. Psoriatic erythrodermic represent the generalized form of the disease that affect all body sides, including face, hand, feet, nails, trunk, and extremities. Although all the symptoms of psoriasis are present, Sigma is the most prominent feature, and scaling of is different as compared with stationary psoriasis. Instead of thick adherence wide scale, there is superficial scaling. Patient with erythrodermic psoriasis loss excessive heat because of generalized vasodilation, and this may cause hypothermia. Patient may shiver in an attempt to raise body temperature. Psoriatic skin is often hypohidrotic due to occlusion of sweat duct, and there is an attendant risk of hypothermic in warm climates. Now, medication treatment depend upon the system and whether you have other health problem. You may be prescribed a combination of one or more drugs, cyclosporin, infliximab, or infliximab epta, or and infliximab dip. Maybe first line of the defense. They work by stop attack out of control immune system. These medicines are powerful, can may have side effects. Talk to your doctor to find they are right for you. Make sure they are aware of any other condition you have or any other medication you take. Topical treatment include to soothe your skin from outside. You can use steroid cream, ointment, moisturizer, wet wraps, oatmeal bath. Other treatment, you also use antibiotic to prevent infection, pain medication, drug to control itching, medication to relieve anxiety. Now come to the case. 60-year-old male shopkeeper is experiencing redness, scaling, and itching all over the body since 20 days. Patient was apparently asymptomatic 20 days back. Then he developed erythema and scaling over trunk, extremities, face, neck, and scalp. Also include palm, soles, genitalia with itching. No history of joint pains, fever, and chill. Past history of patient is hypertensive since 9 months on irregular medication and non-psoriatic since 10 years. He has no history of family psoriasis. His lab report shows BP on day 1 is 130 by 90, day 2 is 120 by 90, on day 3 is 120 by 80, and on day 4 110 by 70. RBC count is 80, serum urea is 24, serum creatinine is 1 mg per dl. Snail become brittle, oncolysis also seen. Now, subject age is 60-year, gender is male, occupation is shopkeeper, complain of redness, scaling, itching all over the body. Patient was apparently asymptomatic since 2010. Then he developed erythema and scaling over tongue extremities, face, neck, scalp, and also including palm, sore, and genitalia with itching. No history of joint pain, fever, chill, chills, no history of diabetic mellitus, TB, asthma, and epilepsy. And past history is hypertensive. Family history, no family history of psoriasis. Personal history is normal appetite, disturbed sleep, diet normal, chronic alcoholic, and smoker since 20 years. And now BP is day 1, 130 by 90, day 2 is 120 by 80, day 3 is 120 by 80, and day 4 is 110 by 70. Pulse rate is 84, 80, 84, 82 respectively, and temperature is normal. RBC count is 80 mg, serum is 24, serum creatinine is 1, sodium is 133, potassium is 4, serum protein is 6.8, serum albumin 3.6, bilirubin is 0.9. Palm, sole, and genitalia was involved. Pitching is also seen. Males become brittle, oil formed, and patches present. Oncolysis is seen. HB is 14, WBC is 8,200, neutrophil is 66%, lymphocyte is 30%, eosinophil is 2%, basophil is 0%, monocytes is 2%, platelet is educate, ESR is 0.5 mm, few reactive lymphocytes plus blood picture is normocytic, normochromatic, complete blood picture. Assessment based upon cutaneous examination and skin biopsy report, the disease was diagnosed as psoriatic erythroderma. Now, plan for erythroderma psoriasis is restore and maintain body fluid temperature followed by antibiotic as the prophylactic to infection and symptomatic treatment. Medication include monosef, ceftriaxone, Lantic, ranitidine, avil, phenyramine, malate, antihistamine, and methotrexate is immunosuppressant, folic acid, multivitamins, vitamin B complex, Inapril, anti-HTN tablet, and liquid paraffin, emollient, bechamethasone is used as anti-inflammatory. Psoriatic erythroderma represents the generalized form of disease that affects all body sides, including face, hand, feet, nails, trunk, and extremities. And smoking is also associated with psoriasis. Smoking appears to have role in onset of psoriasis. Recently, a gene environmental interaction identified between low activity of cytochrome P450 gene CYP1A and smoking in psoriasis. Avoid alcohol and smoking. Take oatmeal bath. They can help losing scaling and reducing itching. Bathing in very hot water or using abrasive cleaner can also promote psoriasis. Avoid stressful situation when you can and take extra steps to take care of yourself, such as eating, exercising, and getting enough sleep. Regarding lifestyle modification, dry skin is more susceptible to outbreak of psoriasis, so keep your skin well lubricated after bathing or showering. Seal in moisturizing moisture by applying a generous amount of moisturizing cream or oil to your skin. Use talcum powder to prevent oozing skin from sticking. Minimize sun exposure. Thank you.